Welcome back to Life on Pause, a podcast defining the experience of being a young adult with cancer. I'm your host, Jill Robertson. This is part 2 of our conversation with Karen Powell, a nurse practitioner at Memorial Sloan Kettering Cancer Center who specializes in breast cancer care. If you haven't listened to part 1, I encourage you to go back and hear Karen's powerful family history with breast cancer and how it shaped her career path. Today, we're focusing on Karen's own diagnosis at age 39, a moment that transferred her from provider to patient overnight. Karen has done everything right. She was a lifelong runner, a healthy eater, a non-smoker. She had been genetically tested and came back negative for the breast cancer genes. She was months away from getting her first scheduled mammogram when, on a quiet July evening, a simple itch changed everything. In this episode, Karen shares what it was like to discover cancer as a healthcare professional who treats breast cancer patients every day, how she navigated treatment decisions with insider knowledge, and the profound ways her diagnosis has deepened her work with patients. We'll also talk about early detection, the barriers women face in accessing diagnostic care, and Karen's powerful message about self-advocacy. This is an honest conversation about vulnerability, resilience, and what it means to sit on both sides of a cancer diagnosis. Let's begin. Is there anything that you'd want to share with our audience about how you knew something was off in the beginning and what that was like, just, kind of um, from when you became aware that something was off with your health and just kind of the different ways that maybe you navigated things as opposed to somebody who hadn't worked in the healthcare field?
Yeah, that's a good question. So just for context, everything that was going on with my grandparents led my mother and I to get genetically tested, and we were both genetically negative. My mom has two sisters and herself, and none of which they're in their 60s and 70s now, and none of them have ever developed breast cancer in their life. I also have a sister. So all my first degree relatives with a genetic negative background led me to wait till 40 to get my mammography. Fast forward to July 29th, 2024. My husband was traveling for work, and I remember it being a very balmy, humid night, and I just tucked the kids away to bed, and I had the windows open and, listening to the crickets and answering work emails. And I had an itch in the side of my abdomen. So I subconsciously went inside of my shirt to itch it. And on the way out, I happened to just graze something with the palm of my hand. And that's when my consciousness started to take over. And my initial thought was, whoa, that was new. What was that? So then I just turned full clinical on myself and just did a robust breast exam and was feeling my lymph nodes and feeling this mass, this little teeny thing that was smaller than a pea, probably half the size of my finger. It was hard, but it moved around. So I understand why women who are 39 years old with 4 children in a career would have likely dismissed it. And what separated the clinician side of me was I could feel irregular borders. And that's something that I wouldn't expect a person that wasn't in this field to be able to differentiate.
Mhm.
So I went for my baseline mammography 2 days after. And myself, along with the radiologist, who's also my colleague, looked at the images together. And she leaned in very warmly and said, I know you know what this is, but we still need to get a biopsy. And as you're laying on that table and your head is spinning and with a million different thoughts, and what was 2 days ago me laying in my bed very zen answering work emails to this moment, it's a whirlwind. And it's a whirlwind for everybody. And nothing prepares you for that moment when you're told that you have breast cancer. There's no education, no experience, and really there is nothing. I mean, it's a gut punch. Ironically enough, I had my results come through while I was in the middle of my clinic. So I was wearing the white coat I was I had patients waiting in rooms and I saw my results. And I took a moment and something overcame me. And I just thought to myself, I took a deep breath and I thought to myself, no one better to go into that room to see that next patient because now I am one of you in every sense of the word. And every day forward, when I get up in the morning and I go to work, I think, no one better. There's no one better to help women or men through this journey.
How long was it after your diagnosis that you felt comfortable sharing that with your patients in a way that was is helpful and relatable for them?
So, it's not something that comes up with every patient,
Mhm.
and um, being any clinician in general, you're kind of by second nature. You have the ability to read the room. So, if I find that my story will directly benefit somebody, I will share. If But in that moment, it's not about me and it's not about my journey. It's about my patient's journey. And so in that moment, I'm not there for me, I'm there for them. And I share my story out of selflessness. And I would say I started feeling comfortable sharing after I got all of my results back and after I came back from my mastectomy.
You don't know how your story is going to affect other people. And so, like, I'm so thankful that you're willing to bring awareness and talk about your journey and also the things that you do for other people who are also walking this um, diagnosis. Yeah. So, how did you decide what treatment path you would take?
So this is where I think being a getting having an insider's view of the reconstruction options was an advantage. And that's also the reason why I think it's important to share my story because of being on both ends of the decision board. So quite frankly, I had the option at the time to have a lumpectomy with radiation because the mass was so small. But ultimately, I had at the time negative boobs. They were not much to write home about. So I know what that cosmetic result ends up looking like. And that just I personally I mean I always exclusively pumped. I never breastfed just to have that sort of control. And the same thing was true for my surgical decision. I wanted control over the symmetry and how everything kind of unfolded. So uh, the unilateral mastectomy was also an option. So I went with that route and then prophylactically, so meaning to, remove the other breast from for preventative purposes, I decided to do a double mastectomy. And I it was one of those decisions that, you're always weighing out the positive and the negative, the risk and benefit. And for me, the benefit of um, minimizing my risk of recurrence as low as I could get it at 39 years old was my first priority. And that's why I decided to do a double mastectomy. Women feel very differently about their breasts, and it's a very personal opinion. And um, I thought for myself that I I wasn't so attached to them, but I understand where the um the the mourning and the loss and there's an identity and there's a sense of emotional attachment that is tied into such a complex body part. So I'm not that that is not lost on me either. And ultimately I like to know how women feel about their breast initially because it really helps me dictate the conversation and help them navigate their choices more effectively. I wasn't really a candidate for a deep flap, which is where you take your own body tissue and you use that to reconstruct a breast. You can also take, you could take free flaps from other areas like your upper buttock area, or your latissimus muscle, which is behind your back, to recreate a breast as well. Um, but I just didn't have enough donor tissue to do that. So, really, an implant was my only option, in that sense. And some women aren't given options. And that is also another conversation. And that's also another piece of the emotional puzzle that is hard to, it's difficult to measure because everyone, recovers emotionally at different paces and they feel differently at different times.
So when you say some women aren't given the options, you are referencing like depending on what their diagnosis is. Sometimes it's like, no, you must do this route.
Need a mastectomy. Sometimes you need a mastectomy. And yeah, and actually that's a good part of my story because ultimately after choosing, or so I thought, to have a mastectomy, when I got the final path report back, not only was it the invasive ductal carcinoma that I felt that was identified on the path report, but there was also additional areas of invasive lobular carcinoma, which was very small at the time, and it went undetected on mammogram, ultrasound, and MRI, mainly because it's a different type of breast cancer. So invasive ductal carcinoma grows like an onion. So it's easy, not easy, but it's more commonly felt and more commonly seen on imaging. Invasive lobular carcinoma lacks a protein, so it grows in a line and it grows in sheets. So it grows adjacent to your breast tissue and makes it a little harder to see on imaging. And majority of the time, invasive lobular carcinomas are discovered in later stages when they're more identifiable on screening. So ultimately, would have probably needed to go back in for a mastectomy because of this surprise cancer that nobody knew that was there. But fortunately, it was all local. There was nothing in my lymph nodes. So I was able to, have a mastectomy and my oncotype score, which basically determines whether or not you would benefit from chemotherapy. And it basically is a recurrence tracker. It was very low. So there was no additional need of needing chemotherapy at the time, which is why the mastectomy was an appropriate care plan for me.
When you were diagnosed and trying to make healthcare decisions for yourself, who stood out to you as like your biggest support going through that time period?
Obviously, my husband was, eh, you never know how somebody is going to respond to a life altering diagnosis. Some people surprise you in the best ways and in not so great ways. And from the minute I told him what I felt and what was going on, he was a constant, steady support and, you know, really and quietly so changed around his work schedule. And it was in the middle of summer. So there was no summer structure for the children. And we don't live around close families. So, he took a lot of those responsibilities for himself. And also we live in a community that, I have a great support system here and wonderful friends who um stepped in and, started a meal train and drove my kids to sports and random text from my college friends, near and far, just checking in with how I'm doing. And, it's those little things that really go far because those are the moments that touch you that you never forget.
Yeah, it's surprising. I've heard other people say, and I've had this experience as well. It's interesting who is comfortable with the uncomfortable.
Yeah, that's a great
um,
way of putting it.
yeah, and so sometimes people that you wouldn't expect to kind of rally around and be a constant during those troublesome times, they are. they they end up to
Yeah,
be.
no question. Yeah, and everybody and I think as as somebody who's going through it at the time, my advice would be to, you know, everybody will show up in their own way. And, all you can do is focus on yourself and the people that are The people will show up how they know to show up. And, um, I wouldn't, some people could disappoint and others will, you'll be surprised about. So,
Mhm.
just accept love wherever you can find it.
Yeah. Yeah, that's a lot of times, people they want you to say what you need, like what can I do for you? And I've heard, a lot of people are just like, just do whatever you can, like sometimes you don't even know what you need.
Yeah. And if you are a friend who, or if or if you're a family member and you know somebody who's going through not only breast cancer, but a troubling time, um, ways, if they have children, we had a gift card to have our laundry done. So, little things like that really go a long way. DoorDash gift cards, if you're not a cook, that's a really nice way of feeding a family. Leaving coffee on the doorstep, if you can, a nice handwritten message in the mailbox. Little things like that really do. It seems little to the person who's not going through it, but to the person on the receiving end, it that that little thing will brighten their entire day, guaranteed.
Just knowing that other people are thinking about you is feels supportive and healing and you feel loved. So, how did you balance like your work life and the treatment and the recovery and all of that? Did you take some time for yourself?
Yeah. So interestingly enough, I kept and I think this is, again, everybody goes through their diagnosis and their treatment plan when they're in it very differently. And there is no right or wrong way. So I just want to state that because I ended up not telling too many of my colleagues. And so I work at a satellite in New Jersey, and my surgeon was in New York City, and I had the opportunity to go to the satellite to get my drains out or to do my expansions, and I chose not to because ultimately it would be my own team taking care of me. And it was very important for me to set a boundary between myself as a patient and myself as a provider. So I traveled into the city for all of my appointments, even if they were 5 minutes, because for me, I needed to create that buffer because I knew when I came back to work, I needed to be the clinician and not the patient. And it was a safe space for me in the city to be the patient. So that is how I overcame balancing work and recovery. Now all my whole team knows, my colleagues know, and but at the time that mentally that's what I needed to do for myself.
What are some things that you would like to share with our audience just in general? Observations or um things that you think are important for early detection or yeah, just
Yeah.
anything.
I'm passionate about early detection and um my my journey into finding my cancer early, I like I said, I kind of stumbled upon it. But when I was in the waiting room waiting for my first mammography, I was surrounded by women who were decades older than me. And I looking around and thinking to myself, like, this thing was so small, and I think if I wasn't in this industry, I would have dismissed it for a gland or even an ingrown hair to some extent because it was so mobile. And I was thinking to myself while looking around this room of women older, like, I understand the thought process of thinking that it can't happen to you. And, you know, I I'm a lifelong runner and I'm a healthy eater and I'm a non-smoker and I up until this point, so to speak, did everything right. And I still had cancer before 40. And I want women to know that, don't dismiss your body and to just, whenever you feel something, no matter how off, get the answers you need. And if you're not getting it from your provider, find somebody who will listen because somebody will always listen. And you deserve that because we have one body and one life. And Early detection is a great start in keeping you around for a long time.
As like a preventative measure, the mammography screenings are covered. Is that like a national coverage like through okay.
Yeah, so anybody would qualify for a screening mammography, um, with or without insurance. The gap is the diagnostic screening if additional views are recommended. Um, and that's a barrier to care that really needs a lot of time and attention dedicated to amending that.
Yeah, do you know anything currently that maybe is in the works about that? 'Cause I'll just share personally, I had a screening mammography and, there was, like, some concerning things, and so I had that I had that experience. They wanted me to go on for, like, a diagnostic, ultrasound, and, of course, the screening was covered and then the diagnostic ultrasound was not, and when I, started calling around to try to figure out how much this was gonna cost me, I mean, it ranged from anywhere if I went to, like I didn't realize it at the time, but, like, initially, they quoted me, like, $5,000 out of my pocket, and I was like, "What?" Um, and so then, like, I got some advice and was calling around, and I found out, like, if you go to a freestanding, diagnostic facility, then it's, the price comes down. I think I ended up paying, like, less than $1,000. So, there were some lessons learned there, that um there are more affordable ways to attend to your healthcare even though it doesn't seem like it at first.
Yeah, and the financial burden is a huge deficit to care and to, um, seeking out early detection. The other barrier too is the fear of finding something, and I think with that there's there's a hesitation in getting a mammogram because of fear that it's going to hurt or being called back for screenings. But you know, I would say that a mammography doesn't prevent anything, but they can really. I mean, the difference between me finding something July of last year and July of this year could have been more extensive treatment. So, um, I understand the fear that's around there, and so did my grandmother. And I really hope that um, this podcast will shed light on the fact that, you know, what's there is there. And the earlier you find it and treat it, the better off you'll be in the long run.
The care that you provide at your cancer center now, from diagnosis to treatment to reconstruction, you mentioned that you are in the process of getting trained in nipple tattooing. So, can you tell us a little bit about how, like, the reconstruction works and why the nipple tattooing is important?
As the final step in your reconstruction, it's completely elective. You have the opportunity to basically reconstruct a nipple. And there's a couple ways of doing that. You can take your basically your inner thigh muscle and use that to recreate a projection and then tattoo around that. That's become less popular throughout the last few years because it does lead to a pretty significant scar on your inner thigh. So a lot of young women still wear bathing suits, and there's a trade off there. But nipple tattooing has come so far in the last, I want to say, even 10 years. Basically, what we do is we create a completely it's flat, but we make it look like a 3D nipple, so it looks like it has a projection. The inks over time have gotten better with more pigmentation colors to choose from. So working with your clinician in deciding, the appropriate color and the size, is very much a candid conversation, and it is the final piece in your journey that you have full say over, and you have full autonomy over whether or not you choose to have one or not, and even to some extent, what colors you ultimately want to use. So. It's a great offering, and we're bringing it into more outside of the scope of New York City. So we're offering it to women in the regionals because our wait list for this in the city is like 6, 7 months long. So to create better access to this demand, I've decided to undergo training to start doing this myself. So it all comes full circle in this way.
And is the incentive for you to become licensed to provide that service? Because if it's provided in a cancer center or a healthcare setting, then is that something that insurance would cover versus like going to a tattoo artist who has a very, great reputation and is like, just very artistically talented, but they wouldn't get any reimbursement.
Correct. So it's all covered under insurance. It's part of the Reconstruction umbrella. And the other benefit is working with a provider is, picking up on potential recurrences. So we have identified things in the skin and in the incision line that tattoo artists, as great as they are, just aren't really fully trained in. So um, it's nice to keep that under the umbrella of the cancer hospital for that reason.
As we're kind of winding down our conversation for today, is there anything else on your mind that you wanted to share?
From my, you know, beginning of my journey with my grandmothers to Penn State to my career to where it's led me and my diagnosis, it's it's been always part of my journey, and I'm just honored to share a little piece of my story with you. And I hope that somebody out there is scheduling a mammogram or feeling their boobs right now and reaching out to a friend and, just taking care of themselves and taking care of each other.
I think maybe just one last question. Is there anything that you wish more people understood about um being a breast cancer survivor or somebody even just going through?
There's still probably a little bit of a stigma there and a little bit of a fragility piece that I wish um I wish wasn't there. I consider myself still very healthy, and until that changes, I always will. And I think a lot of times, even in stage one, it's thought of as a death sentence, and it's not. The way care has come and what the advancements have brought, it's not. It's not a death sentence, and it's a life altering diagnosis, but it impacts it impacts us very differently. And I'm still the mom I was a year ago, and I intend to be that way for a long time.
Yes, we wish that for you as well.
Thanks, Jill.
Yes, thank you for joining us today.
Thanks for listening to Life on Pause. Ideas or suggestions for future episodes? Feel free to share them with us. Make sure you like, subscribe, or follow us on YouTube, Spotify, or wherever you listen to your podcasts.